Cardiovascular disease is also increased as your blood sugar goes up. And so as the blood sugar goes up, and we talked about this, I believe, the last time, that a high blood sugar damages your entire body, your entire system. So just like sugar damages the teeth, your high blood sugar also damages your eyes, it damages your nerves, it damages your vessels. And so it increases the rate that blood vessels will clot and get atherosclerosis. So it's very important to lower the blood pressure. Raised lipids or cholesterol is another issue, and obesity, especially as it relates to truncal obesity, is also a major issue. Truncal obesity is that weight we carry between our neck and our hips, right? So most of the weight is there in the midsection. That's truncal obesity, major risk factor for cardiovascular disease. One of the ones that's not on here as well is smoking. Smoking is probably the #1 cause of cardiovascular disease. So when I hear of people who have heart attacks as in their 40s and 50s, or they start to have vascular problems with clotting of the arteries in their legs, I think first about smoking, then diabetes. And so smoking should be on here, and it's a major risk factor for cardiovascular disease. Additional determinants that we have on the side are also major factors. Heredity is probably your #1 factor. So if your parents had hypertension, your risk of hypertension is greater. If they had strokes, your risk is higher. So that really focuses us on how do we prevent cardiovascular disease such as strokes. And so if you tell me that your mother or your grandmother had a stroke, then I know that you're at increased risk, and I know that it is extremely important that we have a blood pressure in the normal range. Stress raises our blood sugar, it raises our blood pressure, it raises our lipids, and it increases our ability to gain weight, especially in the midsection, through our overacting on our adrenal gland. And so that's really, really important that we modify that. Poverty is really, really interesting because poverty affects all of these. And so if I look at how poverty affects stress, how poverty affects the rise in blood pressure. So constant stress, keeping us very, very tense, raises the blood pressure. It also raises the blood sugar. So, and it definitely has an impact on our weight, because in areas that are lower in income, we often see what we call food deserts. And so that's where there's a lack of access to fresh foods because there are not a lot of supermarkets. There are not a lot of high-end restaurants, and what you see are more fast food type restaurants that are going to have more salt, more fats, more processed foods. And so poverty is a huge risk factor for developing cardiovascular disease as well.
You know, as we move to the next slide, I bet you no one ever thought about poverty being such a detrimental factor in our health. But it truly is.
Yeah, we've been able to think about it more. We call it social determinants of health.
Mhm.
And so income is a major social determinant of health. Education is #1. When you look at countries around the globe, when there's a low educational level, there's a high risk, there are high rates of disease. And so those go hand in hand, and education goes hand in hand with poverty and low income. Other social determinants of health include, is there adequate green space? So is it safe for people to go outside and walk, for children to go outside and play? So those are major issues.
Here is your smoking.
My phone did something. There we go. And so that's a major risk factor. So just looking at social determinants of health. As we go into monitoring health behaviors, we have the smoking, we have physical activity. So when we say 150 minutes of moderate intensity activity, that's basically 30 minutes a day. If you can get in 30 minutes a day, 5 days a week, that's what we call adequate or an exercise and moderate intensity of physical activity. So however you're getting it in, it doesn't even have to be a straight 30 minutes. It can be 15 minutes here, 15 minutes there, or 10, 10, and 10. However you're getting the physical activity in is going to be important, and getting your heart rate up. High potassium diets are important, and potassium, many times people just think of bananas as a high potassium food, but it's bananas, it's citrus foods. Spinach is high in potassium. Potatoes, especially the potato skin, is high in potassium. So it doesn't have to be a food that's very high in carbs in order to get the potassium. Trans fats should not be in our diet at this point. Trans fats increase your risk for cardiovascular disease, and there was actually legislation to remove trans fats from our foods. Fresh fruits and vegetables, important, whole grains. So, you know, that diet I had today was very, very high in fiber, not a lot of sugar. So, you know, choose your fruits wisely. And so again, bananas are very high in carbs. Your berries are lower and have a lot of nutritional impact for you. So that's really, really important that you choose your fruits and vegetables wisely. Many people say, well, the only vegetable I like is corn. Well, corn has no nutritional value for the most part, so it has a lot of carbs. And so if you are going to go on a 20-mile hike, you can have corn, but short of that, you might choose to have something else that has a higher amount of nutrients in it. Whole grains, being very careful with whole grains. Again, you can get whole grains with high carbs, and so you want to stay away from that. Alcohol raises the blood pressure, raises your blood sugar, and the reason we say 1 drink a day for women, 2 drinks for men, is once the amount goes over that, it increases, we call it risky alcohol intake, so it increases your risk for addiction to alcohol. And again, family history matters, and so if there's a family history of alcohol abuse, you're much more likely to be prone to that. So just really being cognizant of alcohol intake. Some of the screening tests, when we look at, oops, you went a little bit too fast. I'm going to go a little faster. The last one had what your normal blood pressure is. So Dr. Page, what should my blood pressure be? Well, we generally say 120/80. And so we will sometimes push it to less than that. And so that 120/80 is what we call the average normal blood pressure. If your blood pressure, however, has always been for most of your life, it's been 110/70, well, 120/80 may actually be high for you. But that's generally the guide that we use. Anything over that 140/90 is considered hypertension. And that's when we begin to treat. And again, if you're getting up close to that 140, close to 90, you know that you're really at risk for some of the vascular injury that is associated with hypertension. 180/120, we're talking about treating you in the office or sending you to urgent care or to a hospital for lowering that blood pressure, because again, that's going to increase your risk for heart problems and stroke. Cholesterol at the bottom. Really, if you just pay attention to that top line where it says ideal, and we don't pay as much attention to the total cholesterol, we pay more attention to the breakdown of your LDL, which is the bad cholesterol. So we want the L to be low, all right, and we want the H to be high. So your LDL cholesterol should be under 100. Your HDL cholesterol protects you from heart disease. So we generally say that we would like that to be over 60 to provide that protective effect. And triglycerides go up whenever your carbs are going up, and whenever you have diabetes, triglycerides are going to go up as well. Alcohol is also a sugar, and it's going to raise your triglycerides.
I told you she breaks it down.
So how do we diagnose cardiovascular problems? We do EKGs. And that's that little strip at the top left-hand corner is like an EKG. Mm-hmm. We do echocardiograms. That's like an ultrasound of your heart, so we can see how it actually functions. And EKG is just looking at the electrical impulses from the heart, so we can tell what rhythm the heart is in. The echocardiogram is actually looking at the heart to see how it's functioning, how it's pumping. Is it pumping out the right amount of blood? Is it enlarged? And so the echo gives us a little bit more information with regards to the function of the heart. A stress test can be done as an exercise stress test or a more of a chemical type stress test where we give you something to stress your heart. And we want to see if your EKG changes. You can do a stress echo as well. So we want to see if your heart is pumping differently, if we stress it and make it pump and work a little bit harder. And coronary angiograms, that's basically where we put dye into your vascular system. So it goes into the heart and we can see exactly what happens with the blood flow and how the arteries are open on the heart.
So I want to pose some questions, and I know that the question piece is coming up in just a moment. But when we talk about electrocardiograms and echocardiograms, stress tests and coronary angiograms, those sound so expensive. Suppose we don't have the insurance that can do that. How are we able, especially those that are impoverished, to get these tests?
Well, the EKG is a relatively inexpensive test, so that's done in most physician offices. The echocardiogram is generally done by cardiologists. They're all read by cardiologists, and so then you may be getting into a more expensive test. You know, the challenge is, you know, what do you do if you think you need an echo, or if the cardiologist or your primary care doc thinks you need an echocardiogram or a stress test or an angiogram, and you don't know how you're going to pay for it. That's a major challenge. I don't have a great answer for that, but Medicaid pays for all of these tests. Medicare pays for all of these tests. If you have health care through healthcare.gov, that pays for these tests. And short of that, if you end up in the emergency room and you have no insurance and they feel that this is necessary because it looks like you have heart disease, then those tests are going to be run anyway. So we don't use those as screenings. We don't use the echocardiogram, the stress test, or the angiogram as a screening test. We use those when we think that there's some disease that's happening and we need to further delineate the degree of damage to the heart and to the blood vessels. Echocardiogram can be used more as a screening test. We just want to make sure that you're okay. But even an annual EKG is probably not necessary in people who are walking around and just healthy. Do we have any questions?
So right now we do not. And I want everybody, especially those checking in on Facebook, to just put your questions in the chat. That is the best way to reach out to Dr. Page. And I promise you, just as simple as she has gone through these slides, she will be able to answer your questions. Again, if you're just joining us, this is a wonderful, just a gift to our community through Center for Change. This series of Heart Healthy, and we've done prostate information. We've talked about diabetes. We have given up so much information, and we're glad to have you with us this evening. Do not feel like, oh, my question is not going to matter, because I can guarantee you that it is. You see, I asked, what about the cost of some of these tests? They seem so high. And especially when we were honest and we talked about people living in poverty and the stress that that causes. This is a major thing. So Dr. Page is here for you. And I got to tell you, she's very easy to talk to. Let's move ahead, though, Dr. Page. Maybe we'll get some questions as people warm up.
So African Americans have a lot of cardiovascular disease. Heart disease is the #1 killer for all Americans. You know, many times we think of cancer like breast cancer and other types of cancer because they many times get a lot more press, but it's heart disease that is the #1 killer. Stroke is also a leading cause of death, and not just death for stroke. It's a major issue with regards to disability. You know, so stroke not only affects your body's ability to move, it can affect how you speak, it can affect your spatial arrangements. And so it's really, really important that we prevent stroke and keep the blood pressure down. Mm-hmm. Overweight and obesity, also a major issue. And we talked about diabetes as well as a major risk factor. African Americans have the highest prevalence of hypertension in the world. Again, we can look at diet as it relates to hypertension. We can look at all of those other factors, all of the social factors, the hereditary factors, the behavioral factors that lead to a high prevalence of hypertension. 69% of men, 82% of women are overweight or obese among non-Hispanic Black population over the age of 20. Obesity is a major concern for not only as we get older, but even for younger people. We start to have atherosclerosis, which are those plaques inside of our arteries, as young as in our 20s. And so when you have obesity that's leading to disease such as diabetes, it's just dramatically increasing the risk for cardiovascular disease, joint disease, kidney disease, certain cancers are increased. So obesity is something that we as adults should work really, really hard to reduce that in our children and young people. And type 2 diabetes. Type 2 diabetes is actually more treatable than and treatable, preventable, and curable than is hypertension. So in my past practice, I had a lot of people who would undergo weight loss surgery, so bariatric surgery. One of the first things to disappear was diabetes. So when the weight came down and the diet changed, diabetes was cured, just gone. But hypertension many times remained. So I was easily taking people off of anti-diabetic medications, but not everyone was able to come off of antihypertensive medication. So it's a lot harder to reverse hypertension than it is diabetes.
Wow, I do have a couple of questions that have come in. One of them is, how often should you check your blood pressure? And I'm assuming that's in a day's time.
It depends. So if your blood pressure has always been fine, you go to the doctor, your blood pressure is fine, I would still say you should check it a few times a year to make sure it's staying fine. If you have hypertension, you should have a blood pressure cuff. And so until you know that your blood pressure is down around 120/80 for virtually every day, all day long, it's fine in the morning, it's fine in the evening, it's fine in the middle of the day. Until you know that, you need to be checking, probably at least twice a day, and then following up closely with your primary care provider to say, my blood pressure, and keep a log. And you can share with them, this is my blood pressure. It's fine in the morning or maybe an hour after I take my meds, but by the time I go to sleep at night, my blood pressure is high again. And so that's the information that you need to be giving to your primary care provider so that they can adjust your medications. One, to ensure that you have 24-hour protection against hypertension, and to ensure that you don't need a change in your medication. So if your blood pressure is not completely controlled, I would suggest you check it a couple of times a day, see where you are, keep a log. And also, if you have a blood pressure machine, you need to take that into the doctor's office with you when you go, so that they can make sure that it's reading accurately. So it may be reading low, maybe reading high. So it's very important that you have it checked. The machines that fit onto the wrist are very inaccurate, and so you should not use those. Those that go onto the upper arm are more accurate, but many times their calibration goes off. So you should even have that checked maybe at least 2 or 3 times a year with your primary care doc. Just take, I just want to make sure this is still reading correctly at home. Oh, you're on mute, Monica.
I just saw that. What are some early signs to possible heart disease? Is another question. That one's coming in from Sean Davis, and thank you very much, Ms. Davis.
Let's see, early signs of heart disease: chest pain, fatigue is a major issue. We call hypertension the silent killer because most people don't have symptoms. If you're very aware of your body, you may notice different things that are happening, and for you to say, that's a little different, let me check my blood pressure. So if you're getting, strange headaches all of the time, you just keep getting headaches, you should check your blood pressure. If you're starting to swell in your legs, you should check your blood pressure and get your heart checked to make sure that everything is fine. So congestive heart failure is where the heart is no longer able to pump the blood forward. So if you think of the heart in the middle of a tube, a round tube that connects to this ball in the middle. So the heart has to pump the blood forward, then the blood comes back to the heart, it pumps it forward. Everything is just constantly moving. If the heart fails to pump forward well enough, things start to back up in the system. And when they back up in the system, that's when you start to have swelling in your hands and your legs. That's when you start, when it's severe, you'll have shortness of breath as well as a major sign that there's something going wrong potentially with the heart. And so it's important that you pay attention to what your body should be like. So it's that swelling, palpitations, chest pain, shortness of breath. Those are the signs that you should look for, and to say, this is not normal. I need to see my healthcare provider. And, I would tell my patients who were resistant to starting blood pressure medication that, I would say, if I went to my doctor and they told me, once, my blood pressure's high, I would say, okay, let me check it, right? And I already have a blood pressure machine. And I would say, let me get a blood pressure machine. I'm going to check my blood pressure. I'm going to see what's happening. If they told me twice it's still high or my blood pressure stayed high, they wouldn't have to offer me a blood pressure med. I would be requesting the blood pressure medication.
Okay.
Because hypertension, if you can imagine, watering a flower, right? Or a plant that has these pretty flowers on it, right? You're going to take it over to the sink, maybe turn the water on just a little bit because you don't, you want to just water it. You don't want to hurt it. But say you have that same plant, right? And somebody comes with a garden hose and they put their finger over the hose to really raise the pressure to shoot at your plant. The dirt's going to go all over the place. The flowers are going to go all over the place. Eventually the plant's going to come out of the pot. And so that's what happens with high blood pressure, right? It's that high pressure shooting at all of your delicate organs. It's shooting at the eyes. It's shooting at your kidneys. It's damaging the kidneys. It's just damaging everything because of a high pressure. Just like a high blood sugar damages everything, a high pressure in the system damages everything as well.
I love your analogies. Does the COVID vaccine have any effect on our heart?
Yes, potentially. So the Journal of American Medical Association has put out a couple of articles recently that shows that the COVID vaccine can lead to myocarditis, which is an inflammation of the heart muscle. So there have been a couple of articles in the past month looking at that. It looks like the risk may be higher for younger males. And so myocarditis is being found to be a risk factor for that's associated with the COVID vaccine.
All right, you heard that here. Gloria says, I wake up in the morning with heart palpitations. What can cause this?
All kinds of things. Stress can cause it. Your job can cause it. If you're on medication, if you've had alcohol the night before, those are the major things. But palpitations are generally caused by an increase in your endocrine system, your endorphin system. And so when you have an increase in adrenaline, that's what speeds the heart up. And so it's very important that you figure out what's causing that. Caffeine can cause that as well. And so you really need to get checked out just to see why you're having palpitations. So that's an indication for getting an EKG done, perhaps an echo, perhaps what we call a Holter monitor. And that wasn't on there as far as things that we use for evaluating cardiovascular disease. Mm-hmm. But the Holter monitor monitors your heart rhythm generally it's left on for 24 to 48 hours. And then we can see exactly what kind of rhythm your heart is in when you have that sensation.
Is 120/80 the standard for everyone? We talked about it being a normal, but is it the standard for everyone?
It's the average, quote unquote, normal. But it just depends on what's going on. So sometimes, like I said, we want it lower. And so we generally target for a general population, 120/80. However, if you have certain issues like aneurysms, we actually push the blood pressure a lot lower. And so it just really depends on what's going on. But for the general population, we target around 120/80.
And the last one for right now, how much does sleep apnea affect your blood pressure?
Significantly. So if you can imagine with sleep apnea, it's like you're running a marathon all night long, right? And you're running a marathon with a mask on, right? Like you can't get air in. And so with sleep apnea, what's happening is generally it's the tongue that's falling back and your airways collapsing. And so then you can't get air in. And so for periods of time, you're not breathing. And so the heart doesn't like when you don't breathe, right? And so the heart is going to speed up, it's going to raise the pressure, and eventually your brain kicks in and your brain wakes you up. It's like, wait a minute, you're dying, right? And so you need oxygen. And so eventually your body wakes you up and you wake up and you make sounds and then you go back to sleep. And if it happens again, you'll do this all night long. And there are people who have, apnea, 100 times a night or more. And so that's very significant because you're not breathing at that time. Your oxygen level drops and your body, your heart and your brain, everything is trying to get you to stop doing that. And so it will raise the blood pressure, and it can make blood pressure very difficult to treat if we don't treat the sleep apnea.
So wearing your mask is really imperative if you do.
It is. And some of the newer machines are just, I'm impressed. They don't make a lot of sound. They're not obtrusive. There's one that just pushes right over your nose, depending on how severe your apnea is. And of course, with that, it's weight loss. We talk a lot about weight loss for reducing apnea and snoring.
Mm-hmm. So let's move on. Thank you very much for taking a moment to answer those questions.
You're welcome. Oh, I forgot we were doing a slideshow.
Yeah, no.
All right. So we talked about the silent killer, right? Most people have no symptoms of hypertension. Some theorists believe that the population has higher rates of obesity and diabetes that leads to this high blood pressure. We talked about that. We talked about genetics and Blacks being more salt sensitive. So if you have a salty meal and your legs swell, you're very salt sensitive. If you have a salt sensitivity and your heart rate goes up or your blood pressure goes up, then you know that you have to reduce sodium in your diet. And it's very difficult to do that eating when you eat out. If you're eating processed foods, it's difficult. And you have to not just pay attention to salt. It's actually sodium. And so you have to look at MSG, which is monosodium glutamate, which is many times found in Asian cooking. It's all of the other sodiums that are in there as preservatives. So we know that salt and sodium preserves foods. So you really have to look at the amount of salt that you're getting. And I think we have an upcoming slide that talks about that. If your blood pressure is left unchecked, yes, it can cause damage to all of these parts of the body. As we discussed, it's that high pressure shooting at your very delicate organs. Generally, we say that African Americans respond well to what we call thiazide type diuretics. That's hydrochlorothiazide, chlorthalidone. Those are your thiazide type diuretics. They lower the blood pressure. Generally, they don't lower it a lot in people. So if you have mild hypertension, you may just be able to get away with a thiazide type diuretic. The average person with hypertension is on 2 to 3 medications. Calcium channel blockers are your amlodipine, diltiazem, procardia, nifedipine. Those are your calcium channel blockers. And generally, we find that they work a little bit better in African Americans. So here we go. 1,500 milligrams of sodium per day. But what does that mean, 1,500 milligrams? So basically, it's less than a teaspoon of salt. All right, maybe if you get about a half a teaspoon of salt. And so if you can imagine, right? So if you're salting things, like, wow, you probably get at least maybe a quarter teaspoon of salt when you're putting salt on different foods. It's really not a lot of salt. And so you're looking for words like low sodium, all right? Low sodium even more than low salt. And we talked about diet a little bit. Don't salt your food. If you're trying to avoid salt in your diet, and Monica can talk about this with cooking, it's, we're using spices, we're using herbs, we're using lemon juice, right? So your tongue has taste buds on there, and it doesn't differentiate too much between your sour and your salt, right? So it gives the tongue that that tingling sensation. And so when you want to take out the salt, use a little bit more lemon juice, lime juice, use your other spices that make your tongue happy. And I tell people, if you can't keep your tongue happy, it's going to be very difficult to sustain any type of dietary modification. So most of your salt is in there before you even get it. So if you're eating anything that comes in a box, a bag, or a carton, or if you're eating out, the salt is already there. I had a patient today come in whose legs were severely swollen. We call it pitting edema because we can push our finger in. It's like the Pillsbury Doughboy, right? You push your finger in and it doesn't pop right back out. It leaves a dent. So she had what we call 3+ pitting edema, so much so that her legs were actually leaking fluid out, what we call weeping edema. And so I asked about the diet, and she had sausage that morning for breakfast. Over the past few days, she had ham, so she had foods that were very high in sodium. I'm not sure what is it in pork that really just can send a patient to the hospital when they have congestive heart failure. But it's that processed meats and everything that's in there just really causes fluid overload.
Think about it, sandwich meat too.
It's all of these things. And when we look down here, right, pizza, one slice of pizza has over 2,000 milligrams of sodium, over a day's worth of sodium in one slice of pizza. The bread, and look here below, one slice of bread, 200 milligrams of sodium. So you have a sandwich, that's 2 slices of bread. So bread has a lot of sodium in it. Cheese has a lot of sodium in it. And say you put some pepperoni on your pizza, that has a lot of sodium on there. And if you have a sandwich, if you're putting any type of processed meats. So the reason that there's a lot of salt there is because salt is a preservative, right? And so that's why food was so salted in the past, right? You have salted everything because it would preserve the meats. It salted you salted the pork, you salted fish, right? You have salt fish. And so those are things that preserve. And that's why when we look back at our relatives, many of them did not live into their 70s or maybe even 60s. They had really high blood pressure, lots of kidney failure. And that's really a factor related to their diet because it wasn't their activity. We came from, if we go back 50, 60 years ago, most people were more active, right? Their jobs were more physical than our jobs. So they had the physical activity, but they also had foods that were preserved with salt, and they had a lot more salt in their diet. There's a really good website on cdc.gov. If you just search that site, it really does. There's some great diagrams there that really lay out how your food is already salted and can raise your blood pressure significantly. And that doesn't even talk about like fast food. And she was also eating McDonald's, my patient today with the weeping edema. So the challenge is she was not preparing her own foods. And so when you have hypertension, you really have to prepare your own food. Otherwise, you are getting a high sodium diet.
Mm-hmm. So when someone presents like that, because that could be many of us that are watching now, what do you say to them? And how often do they listen?
They usually listen, and I tell them, my only patients who have strokes are those patients that didn't listen, so I see they come in one day, and they're dragging their right side or their left side. And, I look back at the note, my note was, I gave them a new blood pressure medication, asked them to come back in 2 days, 2 weeks, and they didn't come back. I see them 3 months later and they've had a stroke. And so, again, you have to really look at strokes as preventable. And that will, when I talk about, I believe in being grateful for the small things in life, which are really big when we really think about it. So when I said about my day, being able to get up, go to work all day, take care of people, come home safely, that's major, and so when you have your health, you have everything. And to imagine a stroke, when you have a stroke, it not only does it affect you physically, it affects you emotionally. And so the article I wrote on stroke really looked at people just never being the same emotionally after a stroke. And so, and psychologically as well, your cognitive abilities, that's just something that will really dramatically affect the rest of your life. And so again, it's being really, really serious. You're not waiting for someone to tell you that you need blood pressure meds. You're requesting blood pressure medication if your blood pressure is not controlled.
They're getting into signs and symptoms now, and
Mhm.
as you'll see for heart attack, there is pain or discomfort in one or both arms, back, neck, jaw, or stomach. Now, does high blood pressure cause neck ache? And that was one of the questions that just popped up. So we're getting ready to address that for you.
High blood pressure can give you that headache and that achy feeling. That stress that might be raising your blood pressure can cause that muscle tension that causes you to have that neck pain, the back of the neck pain, back of the head, just feeling really tense in this area. And so the hypertension doesn't necessarily cause that. It can definitely cause you to have a headache. Generally doesn't cause you to have a lot of muscle tension. It usually goes the other way, that your muscle tension is causing you to have more of a high blood pressure. So they're related in that way, not necessarily causative in that the hypertension is causing the neck discomfort. But with a heart attack, the reason that it affects the arms is that's because when we look at the nerve, so the vagus nerve that's going to the heart, it's coming from here. And that's why you're getting symptoms into the neck, into the jaw, and down the arm. Shortness of breath, cold sweats, nausea, lightheadedness, as well as just, we generally ask, we call it diaphoresis, when you just break out into a sweat. Now, the challenge is, if you're going through menopause or in menopause, you might have some of these symptoms as well. And so, but that's fine. Go see your physician and ask them, I don't know what this is, but I'm having these symptoms. And with a stroke, it's that, again, with stroke, it's, we can prevent some of the damage from both the heart attack and the stroke. So the key is recognizing the symptoms early. You've probably heard of clot busters, so we give medication that stops, that breaks up what we call the thrombus. The thrombus is that clot that can be either in one of the vessels in your heart, or it can be in a vessel going to your brain or in your brain. And so breaking up that clot allows the blood to start flowing again. And so it's really important that, if you're having any of these symptoms, it's very important that you seek care immediately.
That face drooping, arm weakness, speech, those are the things that we talk about fast.
Yeah.
You have to call 911 as quickly as possible. This is really good. The face drooping, arm weakness, speech difficulties. It is time to call 911. And the thing is that we have to be advocates and we have to push for ourselves. So information is the best thing, but it's only as good as how you use it. They say that knowledge is key. I say it is key, but it's how you use it that is most important. So that's why we're putting this information out there. And the questions that we're getting tonight are very, very good. That patient that came in with the legs and the edema, I've seen that happen to people before. Is there any way that can be reversed? Is what is the way to relieve some of that excess?
Absolutely. Absolutely. One of the things I like about Dedicated Senior Medical Center is that we take walk-ins, and we're pretty aggressive in the office. So for her, I gave her IV Lasix, so a water pill. So she had the office and put out over a liter of fluid in an hour, and felt as she was sitting there, she could feel the tension in her legs going away, that tightness, because it was so taut. She also was having some signs of congestive heart failure, so I could hear a little fluid in the lungs. After that, within about an hour and a half, I got rid of that. I'll see her back tomorrow. So she's the type of patient I will see you every day. So if, my goal is, and she just came out of the hospital with COVID, my job is to keep you out of the hospital, and to keep you well. And congestive heart failure is something that you can tip into so easily, and you really have to be aggressive with that. So that's the most important thing, is just being, again, you're the master of your health. You know yourself more than anyone else knows you. And, as Monica was saying, there's the knowledge, and I always called it KAB. There's your knowledge, there's your attitude, and there's your behavior. And so if you realize or you think something is wrong, you have to have the attitude of being very assertive and aggressive with regards to getting care. And then you have to follow up with sustained behavioral modifications that reduces your risk of further injury, so doing that, what we call secondary prevention. So primary prevention, we're recognizing, we're screening. Then once you have an issue such as hypertension, your goal is to prevent all of the things that can happen as a result of uncontrolled hypertension.
We're welcoming our Facebook family this evening, Dr. Page, so we're getting some questions to come in from them as well. And Monica asked, how can you differentiate between a heart attack and a panic attack, anxiety?
Well, if you have lots of panic attacks, you may be able to differentiate the two. But if you haven't had lots of panic attacks and you haven't been to the ER for that, then you really can't. And so if you're having symptoms, and many of those symptoms mimic a heart attack, you're getting short of breath, your heart is beating fast, you're sweating, getting nauseous, it's just all of this, again, is that adrenaline pouring in, and you're having all of these symptoms. If it's something that's frequent, then you may be able to talk yourself out of it, and you know that, okay, I just went to the hospital last week, they did a full cardiac workup, everything is fine. And so you can say, okay, you can feel comfortable that everything is fine. If you haven't done that and you're having these symptoms, then you need to seek emergency care.
I would say so. An informed patient is probably the best patient too.
Absolutely.
Because they're going to ask questions, and that's why we want to do these seminars specifically, so you'll have all the information in front of you, and then you can use it and go and have a discussion with your doctor, because that's what you have the right to do.
Absolutely.
Ask questions.
Absolutely.
All right, going to the next one, the impact of stress on our mental and physical health. Oh my goodness.
So there was another good article in JAMA probably about 2 months ago, and it looked at doing a stress test, right? And so we think of stress as, oh, you're going to get stressed. No, we just stress the heart, right? We speed it up. And so they had people come in and they gave them 2 minutes to prepare to do public speaking. And they had to do public speaking in front of 4 people. And while they were doing that, they were hooked up to a stress test. And so they found that psychological stress actually made their heart evaluation abnormal. And so stress affects everything, so that mind, body, spirit is intimately connected. You cannot disconnect it. And so the challenge is, how do you work with it? How do you modify that? And so if we look at the negative psychological health associated with an increased risk of heart disease, absolutely. And I'm glad the graphic is there. So, for my smokers, generally I say, okay, well, why do you smoke? What would help you to stop smoking? Generally, it's stress that makes them, carry out that behavior. Same thing with alcohol, right? So people will say, oh, I get a glass of wine so I can relax. I smoke a cigarette so I can relax. And so now we have these behavioral factors that are associated with the stress as well. So when your body gets stressed, you're putting out all of this adrenaline, and your body does not like to be on an adrenaline high for a long period of time, and it will affect you overall. 1 in 3 African Americans need mental health treatment, actually receive it. Who need mental health treatment actually receive it. I think it might even be worse than that, actually, So for a couple of reasons. One, we in the African American community has not always gone towards professional psychiatric care. Sometimes we go towards the church, we go towards religion, if we have family members, we go to them. But many times you may need professional help in dealing with some of the stressors in our life, because say you had a loss of a loved one. You can't always talk to your loved ones about the loss of a loved one. And so many times it's helpful to talk to someone else about the loss of a loved one so that you work through these issues. If there are substance abuse issues, then you can't always talk to your loved ones, and you can't People say, let go, let God. And, yeah, that's great. But many times you also need to talk to someone. When you talk things out, you let things out, right? So I tell my patients, you either have to talk it out or you have to write it out, right? But you got to get it out of your head. If it's here, it just does this, right? It just runs around. But this is the sign for craziness. And so you have to let it come out. You can't just let it run around in your head because it will create disease. Hispanics are twice as likely to feel hopeless compared to non-Hispanic whites. 1 in 2 adults reported COVID-19 has negatively affected their mental health. And that's very true because of social isolation that occurs with that. Again, going back to, if you can't let it out, you don't have anyone to talk to, you're not journaling, then you're just holding all of that in. And we are very social beings. We're not intended to be alone, which is why solitary confinement in prisons is considered cruel and unusual punishment. You can permanently damage someone's psyche by doing that. And so the body will respond to all of your stressors. You'll feel it. Again, we talked about here, your blood pressure going up, digestive system just not working the way it should work, and the lack of energy, irritable mood, poor sleeping habits. And sleep is also extremely important for rejuvenating your body, not just making you feel rested, but it really does help to rejuvenate your body overnight. So the stressors that we feel we can't minimize them. We have to address them, and getting help is important. So again, there's that cultural factor that gets in the way, but the other thing that gets in the way is it's very difficult to find mental health professionals. There's a shortage of mental health professionals. let me look up something. I generally have people go to a site, if they're African American and they're women especially, many times they may want someone who looks like them as a provider, and it's called therapyforblackgirls.com. And you can find providers on there who are African Americans who definitely address women who have psychological, mental health, stress, all of those issues. So it's therapyforblackgirls.com. I also send people to the website for Psychology Today. On the Psychology Today website, you can see the provider, you can get their history, and it's a good way to find someone if you haven't been able to. And then you'll have to reach out to your insurance company to ensure that that person is covered for their services.
But I also say, though, Dr. Page, if we can afford that new pair of shoes, that dress, we can afford a few moments in a mental health professional's chair, you would be surprised the difference that it can make in your life. And I really just want to say it. I have a therapist. I have a couple of them, when one is not available and I really need some direction, sure. You cannot be ashamed of that.
Absolutely.
I see somebody with their hand raised, but I don't have access to respond. So if you would, put your question in the chat box and Dr. Page will gladly answer it for you. Mm-hmm. Continue, Dr. Page.
Mental health as it relates to disease is just so important. So when we're talking,
I'm sorry, the pandemic, you mentioned this earlier, the pandemic changed a lot of what we were dealing with and living with and managing, so we thought. So, give yourself grace, guys, please. Mm-hmm. Take charge by managing your stress.
Absolutely. One of the things that the pandemic, especially here in Florida, in Florida, you have the advantage of going outside all year round. In other areas in the Northeast and colder areas, you were really, you were hibernating. But going outside, taking a walk, safe activity, mm-hmm. gardening, great activity, safe activity. These are all, though, solitary activities. So just being cognizant that these activities are not necessarily increasing your ability to socialize with others, which is very important for relieving stress and stopping you from overthinking. So when we're alone and we're alone with our thoughts and we're not reflecting those off of anyone, that's when things can go awry. So taking a walk, positive self-talk, When you feel like you're starting to get down, positive self-talk is where you say, you know what, that phrase I used before, you know what, if you have your health, you have everything. Or, you know what, that's true. So you start talking to yourself about, how do you pull yourself out of periods of time when you're feeling low. Deep breathing helps with stress. It can lower your blood pressure as well. So when we talk about deep breathing, it's taking a deep breath in, but if you would look up diaphragmatic breathing, that's the type of breathing that we're talking about. So, there's chest breathing where you're versus using your diaphragm to breathe, where your chest doesn't move at all. That's really important for lowering stress, lowering blood pressure, lowering your heart rate. And so that's something that you want to try doing. And it should be 6 seconds on your exhalation. So practice breathing where you're doing a 6-second exhalation. So that's also very important for engaging what we call your parasympathetic nervous system. And I'll give you an example. So if someone walked up to you and they were getting ready to hit you, right? It's like, boom. And you're not going to go, you're going to say, right? And you're doing, because that's engaging your sympathetic nervous system, right? That's the fight or flight, right? It's getting you ready to deal with whatever is getting ready to happen versus the exhale. That is actually calming to you. It lowers, and that's what I do in my office. When someone has a high blood pressure, I say, okay, well, let's sit here, let's do, and it usually only takes about 3 or 4 breaths. And if you're not used to it, you might even feel lightheaded. And so, but that will I can lower the blood pressure in 5 or 6 breaths easily. Relaxation techniques, those are important. We talked about gardening, exercise. Exercise is so important for hypertension and cardiovascular disease. When you go to exercise, when you're exercising, your blood pressure and heart rate go up. 30 minutes afterwards, you will find that your blood pressure drops significantly from where it was pre-exercise. It allows your blood vessels, it keeps them flexible, right? So when you're out there walking and running, your heart's beating. So your blood vessels have to do this, right? And so that's important for keeping, just like any other part of our body, for maintaining the flexibility of those muscles. Your arteries have muscles inside of them that can cause them to constrict. It causes them to relax. And so exercise is so important for lowering the blood pressure and maintaining cardiovascular fitness. And again, we talked about sleep. That's where your body, your mind, everything just sort of gets better. It rejuvenates, it cleans out all of the waste things and waste thoughts in our mind and allows your body to get ready for the next day. Otherwise, your adrenaline stays too high, blood pressure stays too high, and you're not thinking adequately. And that's why we say, some people say, let me sleep on it. You sleep on it because you think differently after you sleep.
Yes, you do. And what about the lack of sleep increasing cortisol? And that's in our stomachs, or what is that exactly?
Yeah, well, that's your adrenal system, right? So your adrenal system closely linked, right? Your adrenal gland, actually your epinephrine is coming out of a portion of your adrenal gland. And so that your cortisol, your adrenal gland, all your epinephrine, all of those things are causing this active movement. It's causing you to store fat. It's just, and it's just horrible. And so you have to be able to relax, whether it's sleeping, finding something that gives you pure joy, right? Not just relaxation. What is it that brings you joy? And how often do you get a joyful moment in the day? And that's what I would challenge you to do, is to say, okay, what brings me joy? Can I get at least, 30 seconds of joy out of every day? Hopefully it's more than that. That's what, that's why grandparents love the grandkids. That's where the joy comes in. That's why some people love gardening. I love gardening. I love taking care of plants. That's where the joy comes in. I love going to the park to walk. That's where my joy is. Just having the opportunity to do those things. And so you have to figure out what gives you joy. And again, being disconnected from other people is challenging. As we get older, we're more likely to be disconnected from other people. You see some seniors where, they don't get hugs. They can't remember the last time somebody hugged them. And then we had COVID, right? Where you can't hug anybody. You can't shake their hand. You can't touch them. And so, it's really important that we stay connected to people as a way of bringing joy into our lives as well.
Just the thought of not getting a hug. I couldn't imagine because I'm such a hugger.
Yeah,
And even with COVID, I would keep my mask
yeah.
on, but if I saw somebody or I was gonna hug you. Um, what I got out of that really stayed with me is find a joyful moment every day.
Every day.
I'm telling you guys, there is joy in every day. There's joy in just waking up. Giving yourself grace is a fine way to get some joy also. So just, ease up on yourself, relax, take a deep breath, and find that joyful moment. If we don't have any questions, I'd say we move on for the sake of time.
So numerous resources, American Heart Association, CDC. Oh, good. Who got that in there? Somebody on there.
Oh,
It must be me.
you
You
know,
are so good.
we listen to
Uh,
you. We listen to you.
Therapy for Black girls and Psychology Today for resources for mental health. And again, even, if you find that, you're getting through life, you're doing everything you need to do, but, there are times where you overthink things, you worry about things a little bit, or you just feel down, you need to find somebody who you can really tell that to, because sometimes, again, in our community, we don't we don't freely say to someone, yeah, I've been feeling really down lately, because you don't want somebody to say, oh, just cheer up. It doesn't work that way. And so, get somebody to talk to.
Let me just add this in. If you see someone, a loved one, a friend even that is showing signs of maybe not even depression, you may not even know what that looks like. But if they are sad, if they are lackluster, they don't seem to be keeping up with the same routine,
Right.
talk to that person and ask them to, do they want to talk?
Right.
Do they want someone else to speak with?
Right.
Kind of encourage them. You could be
Absolutely
saving their life,
and get professional help, get professional advice, not just anybody's advice.
Not just us, So we have some upcoming events, and these are the flyers that are on the screen right now. The Heart Healthy Nutrition is with one of my favorite Black nutritionists. There was a trio here, Ebony Nutrition, and they are still in existence, and they still, anything under the sun that you can think of, they can make, and they can make it heart healthy. Now, this first flyer is the Heart Healthy Nutrition class. It's a virtual nutrition class. It's February 28th. It's at 11 a.m. and it is via Zoom. I did say virtual. Fabiola Gaines is a registered dietitian, and she's going to provide tips and tools on creating heart healthy smoothies, dishes, and other items that you will just trust me, it's going to be good food. The link shown under the flyer, and I don't know if you can see my cursor, is the way to register. Also, you can call our office, which is 407-271-4452. The Zoom link is provided to you. Live a healthy life with chronic conditions. Learn the skills on how to self-manage chronic conditions like heart disease, and you see the list there. That is, again, virtual chronic disease self-management. It's a workshop that begins on Saturday, March 12th. They'll meet once a week for 2.5 hours for 7 consecutive weeks via Zoom. And that's, not a bad thing. The topics covered are listed on the flyer. The link shown under the flyer is to register for the class. If you're interested, again, that number is 407-271-4452. 271-4452. And last but not least, that is our upcoming and last webinar in this particular series. It's going to be on lupus and women of color. So I'm asking you to save the date for May 18th, 6:30 p.m. new time, 6:30 p.m. More information will be on the way beginning in April from the Center for Change. It looks like we've got one new question here. Will we be getting an email with those workshop flyers? Now, Miss Tamisha is on the line. She's watching, and she would be the one to determine that. So Mimi will be able to help you with that information, but that's not a bad thing. If we have your email address, we can get those flyers to you. Is there any last minute words that you wanted to give us before we sign off, Dr. Page?
No, well, actually, let me give you one.
Yeah.
With regards to finding your joy. So I was home. My home is in New Jersey, and so I was home over the weekend. And my mother is, very, I would say she's very religious, and she made sure that we sat down at the dining room table for church on Sunday morning. And I like having church at the dining room table. And so my grandson was there, who's 9, and then 2 other children, one's 8, one's 7. So we all sat around the table and had church. And so the topic was on Romans, and they talked about 3 things. So how do you rejoice in the good times? How do you have faith that you've come this far and things will still be fine through the hard times, and that that there will be a way that gets you out of the hard time, and maybe find that the other side is even better than where you just came from.
Hallelujah.
And then being prayerful or mindful all the time. And you have to really pay attention to yourself, listen to your body, listen to your mind, listen to your spirit and your emotions, and don't ignore them. Make sure you take care of them.
And it's okay to take some moment for self-care. Do these things for yourself, by yourself, even if you have to. It's going to be very important in the days ahead that you keep yourself first, just like they say on the plane, and put the oxygen mask on the other person after you've taken care of yourself. You're no good for anyone if you're not any good. And I think on that note, I think we've done well. We can wrap up with the post-test. We're going to stay on the line just a little while for you to do that. It's really important, in order for us to keep this good information coming, to know exactly how it affects you. So with cardiovascular disease, and the title of this one being Pressure Up, we're just asking you those same 4 questions and see if you've learned what we hope you've learned. Same 4 questions. And so looks like we're getting good response here. This is good. This is very good. Did you see some of those results, Doc?
I can see them. Yes. You're doing really well.
That is the sign of a good professor.
Well, thank you so much. Thank you.
Within a 45-minute time, 45 minutes to an hour, to make sure that we got everything in. And Adriana says, thank you. Excellent presentation.
Thank you.
Page, again, we can find you at Dedicated
Senior Medical Center, and that's where I am on North Hiawassee.
Just wanted
I think
to
I'm probably on Facebook, but I don't remember my password. Miss May, I'm going to reach out to you so I can have a better online presence as well.
I'm trying. I'm trying. I just wanted to say Sean Davis is on with us this evening, and she's doing a phenomenal event. Heal Hearts is the name of her organization, and she's doing something that she's done for the last 8 or 9 years, and it's in honor of her mother, who was misdiagnosed for so long, and it actually turned out to be heart disease. And so her mom is still alive, thank God. But Sean has honored her mom every year by just inviting women in to just talk about heart healthy things that pertain to us. But this year she's doing it so it could be like a date night. And I think that that is so cool. So when you and your mate are able to have those conversations, look at each other, understand when one is not feeling, you can tell that about your mate. Bring it to their attention. Tell them to slow it down a little bit. But whatever you have to do, we are responsible. We are our brothers and sisters keepers, especially in these times today. So I look forward to seeing you all again in May. We look forward to perhaps seeing you this weekend at CB Bistro for Heal Hearts. And I just tell you, one thing that I look forward to is you, Dr. Cynthia Page. I thank you so much.
I thank you, Monica. It's been a pleasure.
Thank you, everyone. Have a wonderful evening and be blessed.
Thank you.
Good night.
Good night.